73-year-old J.D. Kane is a former aerospace inspector who lives in southern Indiana. A little more than 15 years ago, he started having some medical problems.
I had a little shakeage in my hand and got a little concerned about it. It seemed to be getting worse. So we went to a neurologist. I was having bad headaches, and we went, and that first one diagnosed me as Parkinson's. So he treated me. It just kept getting worse and worse, and my quality of life was going downhill pretty bad.
J.D.'s wife, Donna, says the shaking in her husband's hand was just the start. J.D. started having bathroom accidents, and nothing the doctors did could help.
The incontinence just kept getting worse until finally he had to wear a diaper. He went to one neurologist, and then he went to the other one, and every time he'd go back and tell him he was weaker, and how he felt and everything, he just kept upping the medicine, and they had him on 9 pills a day of this one medicine, and I think it was 3 pills a day on another medicine, and it was not doing him any good.
It was so horrible on Donna. It was like taking care of a baby. I was in diapers, and I couldn't control my bladder, and it was a mess. And also, I was shuffling. I fell down and crawled into the bedroom trying to get up, and I was down on the floor for 6.5 hours. I did not have any strength at all. I fell down our stairs 3 or 4 times. No wonder I hadn't killed myself there, but it was just like that constantly.
J.D. says he also started forgetting things, as if he had dementia. He started losing his temper at the slightest provocation. But the Parkinson's medication did nothing for any of his symptoms. In fact, switching to a new drug seemed to trigger even more problems.
I had went to Texas about work, and I stopped on the way back. I couldn't control my gambling. I always did like to play a few cards, but never anything like it was getting to be. I dumped about $4,000 or $5,000.
Eventually, the Kanes went to yet another neurologist who wondered why J.D. had never had an MRI or CT scan to help confirm the diagnosis. So, after 13 years of struggle, they got an MRI. It showed that J.D. didn't have Parkinson's at all. He had a condition that may look like Parkinson's or Alzheimer's disease. It's called normal pressure hydrocephalus.
Hydrocephalus is a condition of excessive water on the brain. That's what the word literally means. In terms of what we see as physicians, we all have fluid spaces within our brain called ventricles. And if they balloon up and become too large, you get a condition called hydrocephalus.
That's Dr. Marvin Bergsnyder, professor of neurosurgery and head of the Adult Hydrocephalus and ICP Disorders program at UCLA. He says water on the brain, as many people know it, is common in children. But it wasn't until the 1960s that doctors recognized it could also be present in older adults.
We don't understand why this particular form of hydrocephalus occurs in the geriatric population. It may be that it's just a form of degeneration of the brain that affects more the circulation of spinal fluid, and sort of think of it as pipes in your house. As the house gets old, the pipes tend to get clogged up and the circulation is impaired. We see patients with this condition more often also have vascular disease of their brain. You have tiny little strokes, not large strokes, and many of them are clinically silent, but more patients with normal pressure hydrocephalus do have vascular disease. Now, whether one is a risk factor for the other, and which one's the cart and which one's the horse, we don't know.
Bergsnyder says as a result of the clog, cerebrospinal fluid can't drain from the inside of the brain as it normally does. It's a little like a normally fast-flowing stream.
If a beaver puts a dam, you get a pond or a lake above the stream, and presumably something like that is occurring where there's a blockage of the normal flow of fluid, and the ventricles dilate up just like a lake does.
When those ventricles overfill, they affect the nerves nearby, such as those controlling movement of the legs.
If these ventricles balloon up, the connection from those brain cells to your spinal cord get stretched the most because those connections have to loop around those large ventricles, versus the control of the hand, for example, is on the side of the brain, and as the ventricles enlarge, those fibers and nerve cells just get pushed to the side, but they don't get stretched compared to what the leg fibers do. So that's at least the theory of why difficulty with walking is the predominant finding with normal pressure hydrocephalus, because the leg fibers are preferentially stretched.
Bergsnyder says neurons responsible for bladder control are also in the same area. Blood flow to those nerves can also be impaired by overfilled ventricles, cutting nutrients and leading to an even further impairment. Incontinence and dementia are often hallmarks of normal pressure hydrocephalus, or NPH, but troubles with walking show up most often. Many patients say they have a shuffling walk with extremely small steps.
Patients with this disorder often, it's as if their automatic walking system is failing, and they aren't able to do those simple tasks. So they have difficulty initiating gait. When they get going, they take very short steps. If they take a turn, they take very small steps and have to take more steps than other people of matched age would do to make a turn. They have difficulty going up a step or walking in gravel. But the same patient, if you stop them and you say, okay, think about what you're doing, take a large step with your left foot and then your right foot, they can march right down the hallway. But if they get distracted, then these short steps come about. And the original description was that of a magnetic gait. And it's a good description for these patients who really have this, is as if their feet are stuck to the ground.
Bergsnyder says short steps are also part of Parkinson's disease, but it's rare for normal pressure hydrocephalus to include Parkinson's characteristic tremor. Still, the Hydrocephalus Association estimates that as many as 5% of people diagnosed with Parkinson's or Alzheimer's disease actually have NPH and could be treated.
Difficulty with walking, difficulty with bladder control, and difficulty with memory. If you probably walk into any nursing home or talk to patients who are aging, those are very common symptoms of aging in general. The real challenge for physicians and even patients is to figure out what is it about their characteristic findings or the symptomatology that they're having can maybe alert them that, wait a second, this is just not normal aging, or this is just not some other cause that's causing this.
However, Bergsnyder says there's a significant lag between the start of symptoms and irreversibility. Often, before the disorder is seen, it's been present for some time, eating away at the brain's reserves.
You don't become clinically symptomatic until you start losing that reserve where you can no longer compensate, and that's when the symptoms become apparent. So when your mother or grandmother or whatever starts becoming, wow, there's something wrong, well, she's probably had this long before, but now you're noticing it because the reserves have been used up. And it's very typical for NPH that when the patient's tired, so they haven't had a good night's sleep, or they have a minor illness like a bladder infection, that's when their symptoms come out.
If NPH continues untreated, eventually the reserves are completely gone and damage becomes irreversible.
It's a progressive disorder, and one that if you don't treat, you will end up in a wheelchair, incontinent of urine, and demented.
Bergsnyder says a CT scan or MRI can often clearly show whether the ventricles of the brain are swollen, but that doesn't always mean a patient will respond to draining off cerebrospinal fluid. So he says at UCLA they do a test first.
We bring them into the hospital. We put a very small catheter into their spine, a drainage catheter, and we literally drain spinal fluid for a couple days. And I call it the WYSIWYG procedure. It's what you see is what you get, because patients will improve right away. The ones who have the disorder, they will go from, some of them are literally unable to walk, to 2 days later walking around happy as clams. Their bladder control has returned. The family says that they're cognitively much clearer. They're able to play cards again. Once we pull out the drain, the effect lasts for about a week, and then it goes away. For those patients who improve and then get worse again, in essence, we've done a test shunt. But if you take that picture, 90% of those patients will get better with a shunt.
A shunt is a tube-like device implanted under the scalp that drains excess spinal fluid from the brain into the abdomen. It needs to be closely monitored so the right amount of fluid is removed. Having too little cerebrospinal fluid can be fatal, but once it's adjusted correctly, the canes can tell you it works.
It was almost immediate to me. I mean, I think by the time he left the hospital, his incontinence, that was the first thing. It went completely away. And I don't think I've ever heard him say, I don't feel good of a morning now when he would wake up. And that was every morning, I don't feel good. But it was just almost instantaneous after he had that surgery. It was just remarkable.
You cannot believe how much better and how fast I felt better. I have no doubt that they hit the nail right on the head, because it's not a dark, bleak thing. Life isn't anymore. I look forward to getting up. I am back to a good life.
Bergsnyder says the earlier NPH is treated, the better. Some patients respond well to a shunt, but their brain reserves are so depleted that they backslide within a year or two. Others show no more symptoms for 15 or 20 years, and it can be a major turnaround for someone who had thought they had Alzheimer's or Parkinson's disease and were getting worse by the day. You can find out much more about normal pressure hydrocephalus online at lifenph.com or through a link on our webpage, radiohealthjournal.net. I'm Reed Pence.
Do you or someone you love have Parkinson's disease? For the more than 5 million people worldwide living with the disease, seeing a doctor who specializes in Parkinson's can help optimize care. Yet survey results show that fewer than half of patients have ever seen a Parkinson's specialist. Partners in Parkinson's, a strategic health initiative of the Michael J. Fox Foundation and AbbVie, offers free in-person educational events in communities across the country. These events connect patients and families with resources, including local support groups and services such as healthcare providers and clinical research opportunities. Kate Harmon, whose father has Parkinson's, explains.
When my father was diagnosed with Parkinson's, my family knew we needed to get him the best care possible. I attended a local Partners in Parkinson's event and met so many people who are new to a Parkinson's diagnosis. We learned about the disease and met with healthcare providers and other members of the Parkinson's community based right here in our area.
To learn more about Parkinson's disease, attend a webinar, or to find an event near you, visit partnersinparkinsons.org. That's partnersinparkinsons.org.